woman end up being my wife. Even if she go away, 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 I'm a classic man. You can be mean when you look this clean, I'm a classic man. Calling on me like a young OG, I'm a classic man. Your knees get made by the street, elegant, old-fashioned man. Yeah, baby, I'm a classic man. I burn through the hood like war. When everybody feeling so cold, I cool like that King Cole. And get a bit of my glow. I got charm like a leprechaun, mama. Now y'all with the rum, mama. Cheap beat like a dumb, mama. And we don't live by the law, mama. Even if she go away, 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 I'm a classic man. You can be mean when you look this clean, I'm a classic man. Calling on me like a young OG, I'm a classic man. Your knees get made by the street, elegant, old-fashioned man. Yeah, baby, I'm a classic man. I burn through the gate like whoa, and everybody getting weed low. Love life, living like whoa, and then they wanna get in my glow. I got mad love for my Cuba. I'm the man who you up. Try and make a do, mama. Even on the fire, I'm cool, mama. Even when she go away, 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 I'm a classic man. You can be mean when you look this clean, I'm a classic man. Calling on me like a young OG, I'm a classic man. Your knees get made by the street, elegant, old-fashioned man. Keep my gloves dirty, but my hands clean. Gotta keep the business in the family. Red when I'm filling up the slang cane like a dandy. Tell you how I grew. You pull out rubber bands, I pull out an envelope. The ladies on my elbow ain't for the show. Every madam on my team is a top general. Gotta be ready for war. Should they get into my door? Get him, we'll get him. I know that we'll get him, cause I lived through this before. I'm a classic man. You can be mean when you look this cool. I'm a classic man. Calling on me like a young OG, I'm a classic man. Your knees get made by the street, elegant, old-fashioned.
Lizzie Guy with the Bow Tie checking with you live for another edition of Business and Benefits. Thank you for tuning in, folks. Rosalind asked for a link. Oh, she found a LinkedIn link. Thanks, Rosalind. It's a little slow for some reason. StreamYard is not liking me, but that happens. It's okay. Well, welcome, folks. Today is a different edition of the show. I'm going to be flying solo for a bit to go over some important stuff because it is open enrollment season officially right now. So there are things that people need help on when it comes to understanding insurance and all that jazz. So let me get some screens fixed up real quick. And let us know where you're watching from #Team Live, #Team Replay. However you consume the content, we appreciate it. So please let us know in the comments below. And we will jump right into talking about some fun stuff. We have Rosalind here, Team Live. Thank you, Rosalind. New avatar. You're getting some new headshots going. Good job there, Rosalind. And the reason I say it's open enrollment season for people that aren't familiar with the that aren't in the U.S. Insurance usually for health benefits, dental, vision, disability, and things like that. Usually those will enroll in the fourth quarter because they want to have them start January 1st. So that's why this is that time of year. And I wanted to ask a question while we're kind of going through this as well. Where'd it go? Oh, and there's a link in the comments, guys, too. I almost forgot. If you want to jump in and ask questions on insurance, there's a link in the comments. I'll bring you in kind of as people jump in there. So you can jump in there, use a link in the comments. You can ask questions and go live, or just asking the chat. Rosalind said, "It's my messy hair, but I like the photo avatar." Hey, works for you. If you like it, you like it. I'm cool with it too. So to start out with some open enrollment. So basically for major medical insurance, those of you that run a small business, this is that time of year when you start getting pressure from your employees if you don't already offer a health plan to get a health plan. The reason you get pressure for them is because they are seeing commercials now, or should be seeing commercials starting soon, for the marketplace for healthcare.gov. So as we understand today with current news, the person at the White House has been diagnosed with COVID-19 right now, as Whoopi Goldberg calls him, the person at the White House. So what that means right now is there's more of an awareness of COVID-19 for the people that maybe didn't pay attention to it too much or didn't put a lot of thought into it now. Now it's front and center in headline news right now. So with that said, there is a heightened sense of the need for having things that'll pay for healthcare sometimes. A lot of times, in my experience, people aren't really thinking about that all year. It's not a fun thought. It's not a top of mind thing unless you need it. So kind of right now, I'm seeing the uptick in people asking questions, trying to figure out what's going on. So if you have questions about health benefits, that's what the point of this is, or even dental, disability insurance, life insurance, this is the time to do that. And make this about you guys, not about one of my guests. It's about you asking questions. So a question that somebody asked me in a post leading up to this was about what do we expect to have happen with healthcare benefits for 2021. So with healthcare benefits for 2021, for everybody to understand the way health benefits are underwritten, a health insurance company can't just raise rates legally because they just want to. There's rules in place to help prevent that. But the very big but right now is if people have to go into their reserves, basically the money they've been saving for a windfall or money for a bad year, that's when they can basically say, you know what, we had a bad year. We need to start charging more for health insurance. So that's the bad thing going on right now, because a COVID-19 case for a good situation, most studies find that it costs about $75,000 for a good situation, basically what's billed to the insurance company. That doesn't only go to the policyholder, but as far as the billing for the procedures, average study shows about $75,000. So with that said, there's been a lot of situations where hospitals are billing health insurance companies for all these different things going on. So with that said, that's going to mean that there's increased costs because the insurance companies will say, we got to get that money back from somewhere. So that's an unfortunate thing to kind of pay attention to. That now, because of that, you're going to have to think about rates will go up. So for small businesses, if you are a small business or an employee of a small business, the kind of workaround for this right now is if you look at rates for 2020, you will avoid that rate increase. So this is kind of not so good news for most insurance brokers. They want the rate to go up essentially, but I don't, because I know this is a means to an end for health insurance. So if you lock in your rates before a rate change, that means you lock in the rates for that year. So I'll give an example. We're at October 2nd, 2020 right now. If somebody says, hey, I want health insurance right now, they might be telling me they want it for January 1st, 2021, because it's open enrollment season. That's the common time people ask for. But if I can even get suggestions to them, say, well, hey, if you want to, if you have the plan start December 1st, you would lock in the rates for December 2020 versus January 2021. So what that does for you is you defer the rate increase for a period of time. It's not a permanent thing because obviously it'll be 2021 at some point and you have to get on those new rates. But it helps the small business employer to kind of defer this rate shock, because in my experience, I think rates will probably go up double digits in most cases, unless you have a very young audience of employees, then it might not go up so bad. But average, if you have like middle-aged, upper-age people for your group, we're expecting like double-digit rate increases. So let me know some reactions, how you feel about that down there below in the comment section. Just because that's not good news, we all kind of hope that affordable healthcare would help with things like that. And it helps in certain regards, but this is just a lost situation. I mean, imagine if those of you that live in California, New York, Atlanta, we have a lot of bad drivers here. So as a result, car insurance can be expensive here sometimes because of everybody else. So when you think about that with regards to health insurance, because of everybody else, quote unquote, that got sick or something, the rates will be higher for the health insurance too. So you got to think about that going into open enrollment. Another question, let me switch over here to this other question. Oh, in comments, let me catch up real quick. We had Judy, Judy's Team Live. Thank you for coming in, Judy, all the way from Trinidad and Tobago. Thanks for joining in. And Diana Parker out there in Florida. Dan, I want to ask you how the I know Disney laid off 28,000 people recently. What's that rumble like there in Florida right now with that going on? All the people being laid off in Florida because of Disney. What's the rumbling for Florida? Because that creates an interesting situation for the marketplace. Because the way I understand it, those people thought they were coming back to work, like they were furloughed, that they're going to come back, and that means they weren't applying for jobs that whole time. So now they're kind of in this rush, I think, to find something, but they don't have healthcare or anything. So let me know what it's like, the rumbling for people down there. And Rosalind City's afraid to debate. So Rosalind thinks that, I guess, that Trump doesn't want to debate, so he's playing sick right now. Hey, I don't know. It looks like it's pretty legit that it's actually a real sickness, but we'll have to wait and see, because obviously there's so much disinformation out there. You got to be careful. So, Anna, let me know that. The other question somebody asked me was picking a plan. What are the options that are available? Now, if you're looking at the marketplace, it's really only a handful of options. Most states I look at, I only see 3 carriers. Like, for example, here in Georgia, you have Ambetter, Kaiser, and Blue Cross Blue Shield. Depending on the doctors you want to use, that limits the people you can choose from, because some of these plans don't work in certain hospital systems. The capitalism side, I guess, of being a hospital has created a situation where people want to copy the Kaiser Permanente model. So if anybody's familiar with Kaiser Permanente, let me know in the comments if you use Kaiser Permanente and how you feel about them. Some of you are in different states, so Kaiser is nationwide, but they're more popular in certain states. So let me know if you've used Kaiser before and your thoughts on them. But the way Kaiser works, Kaiser is a true HMO. What I mean by that is that's a health maintenance organization. A true HMO means you have to get a referral within the network. Now, in some situations, people don't like that. But with Kaiser, everybody's in the same building for the most part. When you get a Kaiser plan, usually your hospital has everything in it. So you see a cardiologist here, endocrinologist, primary doctor, OBGYN, surgeon, everybody's in one building. Most of the time, they have little satellite offices, but for the most part, everybody's in one place. So there's good and bad to that. If you live by one, it's awesome. You can go to one building for everything. If you don't live by one, well, then you have to travel a distance to get there. So I know, like in California, Kaiser is a big deal. Georgia, so-so. There's certain places where it's great, certain places in the rural areas, not so good. So it's important to know that when looking at a plan. And I know this is boring stuff, but it's important stuff because I think about my days when my wife was getting insurance through her job. I was the one tasked with figuring out the insurance, and I didn't know what I was doing all the way. I would just get a website and say, hey, figure this out, take a look and see what you see. And I would just look at the price. I wouldn't look at the network or the deductible. It was really just what's the cheapest plan that's available and what's the deadline. So I think it's important for people to hear this information and kind of understand what to do when it comes to picking a plan during this busy time of year for benefits. Put this switch quick. Okay. So remember the network. If you're in a certain area, you only have 3 choices. Now, some states, like I was helping somebody with Maryland, somebody else in Michigan, I believe it was. Certain states have a state-run marketplace, so they don't use healthcare.gov. So those of you here in the U.S., if you're self-employed, this is important. If you work for a company that does not have benefits, this is important. If you are a gig worker, like you work in kind of like a Uber or a Lyft or a Postmates, something like that, this is important. Usually in those situations, you don't have a company health plan. That just isn't a thing for you. So with that being said, you have to look at the marketplace. Now, the 3 things or 4 things that help you figure out a plan on the marketplace are age, income, zip code, and family size. Now, family size, what I mean is on taxes. If the person's not married, it doesn't affect the family size, but if it's on taxes, like a dependent or a spouse, that affects that. So for the marketplace, it's age, income, zip code, and family size. Those are the 4 variables to figure out, is a plan going to be cost effective on the marketplace. So oftentimes people will ask me like, hey, what's it going to cost for me to get a plan on the exchange? I can't just tell you that. There's no definitive answer because I don't know your age, your income, your zip code, or your family size just for telling me that. So that's why when you look at that, you have to actually know those things when you talk to an agent. So if you're going to go out there and try to get quotes for healthcare.gov from somebody else or just calling an agent, you need to know age, income, zip code, and family size. So with that, when you put that in there, the system will look and see what is your income and do you need a subsidy. Now, if anybody's used healthcare.gov before, let me know your thoughts on it, positive or negative, because I see a mixed batch. The good thing about it is pre-existing conditions. So most people have some pre-existing condition that precludes them from having underwriting from a health plan is underwritten. So the beautiful thing about healthcare.gov and the Affordable Care Act is no pre-existing conditions can deny you coverage. But at the same time, the people get upset about subsidies. So if your income is not in line with what they want for a subsidy, you'll pay full price for health insurance. And I think the reason people get kind of bent sideways about that, because when you work for an employer, you don't realize how much the employer is paying to help reduce your costs. So when you work at a restaurant or a daycare or whatever, you're going to see your deduction usually for your benefits on your paycheck. You're not going to see the total cost the company has. So you might see, oh, I'm paying $100 a week for this policy, and the employer is doing the same thing, but you don't see that. So when you go to the marketplace and say, I'm going to go get some affordable healthcare on my own, my boss isn't doing it, oh my God, this is so expensive. It probably really isn't that much more expensive than you were paying as an employee, but your boss is paying part of it. So that's important to realize, because I talk to entrepreneurs a lot, or solopreneurs, and they get sticker shock, and I understand it. It's pricey because you're not used to that. So bear in mind, and this doesn't apply for those of you in Canada and other countries, you don't have to worry about this, but the people in the US, we don't have that system of insurance. So the rates are kind of hairy sometimes. Somebody in their 30s or 20s, you can expect the low, only mid 200s to low 300s for someone in their 20s. But as you age, the rate gets higher. So it's important to kind of understand when people kind of gripe about affordable healthcare. I get it. Healthcare should not be pricey. And if you feel differently about that, let me know in the comments, just because some people think it's a right, some people think it's a privilege. There's always kind of debates about that. When you think about it, at the end of the day, the pricing is not quite leveled out for people. So that's important to know when you go into open enrollment season. Know that if you go to the marketplace, it's not going to be the same rates like you were paying as an employee. It's just, that doesn't exist that way. That is the biggest, I wouldn't say issue, but the biggest response I get from people is like, man, this is way more expensive than I thought it would be. So go in knowing that, so you don't kind of get surprised, like, why is this so expensive? It's going to be more than you're used to unless your employer wasn't paying. Now, does anybody here, I'll leave it for a second and say, does anybody here have an employer that is actually providing the benefits? If you do, let me know in the comments, because I think it's something that's important to know, that most small businesses don't have benefits, but let me know in the comments if your employer is providing you some form of health benefits. That could be a stipend, that could be they pay for your health insurance 100%, that can be just they offer you something. The studies actually show us a low portion of employers that are doing that. So let me know if your employer is helping you with your health benefits, because in the US, that's really the primary way people get insurance is their employer. Some other places, that's not true. They get it through on their own. But in the US, that's kind of the system we're faced with. So questions anybody has real quick while I switch screens here for a second. Let me know any questions you have. There we go. All right. Oh, and also, I'm curious to see from people. I put a post about when the White House revealed the positive COVID diagnosis. I want to get you guys' thoughts on that, like how you feel about the positive diagnosis in the White House, because I mean, it's kind of shocking. A little shocking, but not shocking. Let me know what you guys think about that too. There we go here. And Rosalind cut up with your links there. She said, "Where's the link?" Guys, this is the link if you want to jump on and ask questions or just talk about whatever's going on right now with everything with COVID. Put it on the screen right quick, just in case you don't see it in the comments. So the next question I got from a story about this. Let me switch back to here. The other question was the different kinds of networks. So there are different kinds of networks for health plans that a lot of people don't understand. You're going to hear HMO, PPO, and POS. HMO, PPO, and POS. So an HMO is a health maintenance organization. We talked about that earlier with regards to Kaiser and different places like that. PPO is preferred provider organization. That's kind of the middle plan. And the last is POS, is point of service, whereas basically that's the one that's highly sought after. That's the one everybody wants. So I'm God, Rosalind. I'm waiting to hear what QAnon says about it. Okay, so we'll see what QAnon says about the positive diagnosis. I like when people try to get me to laugh on camera, so that's funny, Rosalind. Thank you for that. And Noel said, great information, girl. Thank you for that, Noel. Out there I think you're in Cali. I forgot where you were that fast, Noel. But as you're looking at the plans, HMO, PPO, and POS, that's an order of cost. HMO is lowest cost, PPO is middle of the road, POS is highest cost. Now, the reason that is, HMO, you have to get a referral. That's not the worst thing in the world unless you have a specific ailment or something that is more requires a specialist frequently. Then that gets to be annoying because you have to go see your primary doctor just to get a referral. PPO, preferred provider organization, those you can go out of network and see who you want, and there's a negotiated rate. So you do have a primary doctor you go see all the time, but you have a negotiated rate that's not as bad as going out of network for somebody in the PPO. And the POS, do whatever you want. They pretty much treat all doctors the same, but you pay for that on the premium. So if you have a more specific ailment or something that requires frequent care, POS is usually the best option just because you can do what you want. But if you have a condition you have that requires, that can be patient, that you don't have to wait, that you can wait a period of time between seeing the primary and your specialist, well, then the HMO will save you money all the way. Now, most of the plans you see on healthcare.gov are going to be HMO. That is a big difference. So those of you with employers or that are an employer yourself, the plans you see when you buy it on your own as an employer to say, I'm going to buy a health plan, usually those are POS. You'll see a lot of POS plans from Humana, United Healthcare, Blue Cross Blue Shield, Aetna. You see a lot of POS for those, which is why it looks different when you go from your own individual plan through the marketplace onto I'm going to buy a plan for my business. So there's always a little difference there in understanding why is this more expensive. Part of the reason is there are better plans for the employer purchase option, and usually that's because of the network type. So the reason the marketplace uses HMO, it's basically a public health kind of thing. They're trying to control the care a little bit and not overwhelm the doctor so much. So HMO is why most of those plans exist in the marketplace to kind of steer people in this better model so that it's not every single hospital is overrun. And also realize these hospitals are making deals with the health insurance companies to kind of keep rates to where they're making enough money off of it. So anybody here that has a marketplace plan probably has seen where certain doctors don't take it. They might say, nope, we don't take that kind of plan. It's interesting that here in Georgia, when Humana was available through the marketplace, it was doctors only took private Humana. They wouldn't take public Humana, they took private Humana. The reason was because the private Humana had a better payout for the doctors, and they were also POS plans 9 to 10 times. So they wanted to get that better payout. So that's the reason why it's important to know as an employer, when you're looking at different plans, the reason why a marketplace plan is going to be cheaper sometimes than a marketplace plan. Now, there are a caveat out there. All employers are, well, let me not say all employers. Generally, for major medical insurance, an employer is required to pay half of your premium. Let me say this again, for the employers that are looking for, I want to get health insurance potentially or something like that, usually for major medical, employer is required to pay half of the premium for the employee price. So not the family, not the spouse, not the kid, just the employee price. That's important to know for employers. So if you didn't know that as an employer and you said, hey, I want to get benefits for my people, that's important to know because you're on the hook for half the premium. And the cost of that to me is to help you retention. If anybody here in the comments has chose a job or denied a job because of benefits, let me know. If you either chosen a job or denied a job because of benefits, either hit a reaction or type in the comments that you've done that. I've seen that happen firsthand with employers who are like, hey, I really want this employee, but they said benefits is a deal breaker. They don't have anything. So that's why it's important as an employer to know if you're paying half of that premium, it's not just wasted money, because sometimes employers think that way. That's money to keep that employee around longer or attract that employee. So if you ever made a job decision based on benefits, let me know, because the first reason people get a job is usually income. Number 2 is benefits, but they're very close, very, very close. People will often make a decision to say, I'll take the job with lower pay if I can get benefits versus the one that doesn't have it. Because people know this is how much health insurance costs my own. So that's the reason that you'll see that in the marketplace sometimes. And here we go. Pardon my dog in the background, guys. Live internet. Okay, another question I have from a story was about the dental and vision. This is a question that's hard to deal with here in the United States right now. So dental and vision is important but it's just tricky to get sometimes for small businesses. So there are dental and vision plans available independently. You can just buy on your own. You can Google dental insurance and vision insurance. You can buy them independently. It's important to know where they're taken. I've had a lot of people that have found plans online and didn't talk to a human. So they ended up having a plan that didn't work in their area. It wasn't what they thought it was. It didn't cover what they wanted. So it's important to at least have a conversation so someone can tell you, nope, this isn't working in Philadelphia. Nope, this doesn't do this. This doesn't do that. Because that's the reason people have a hard time with insurance, because they don't understand the terminology. So when somebody says, here's a dental plan, they're like, oh, okay, great. I've seen people pay for discount plans thinking it was dental insurance. I've seen people paying for plans that were covered for out-of-state places that didn't work in their state. So it's important to have a conversation with a human so you at least know what you're getting into. Because that's the problem, is if you don't know what you're getting into, it's kind of a waste of money. So my soapbox moment for dental and vision, dental can be worth it if you have things you need to have done, like if you go get cleanings frequently or fillings and surgeries. If that's not a common thing for you, I'd recommend everybody to think about how much do you spend on your dental coverage in the course of a year versus how much you get out of it. Now, that's not popular usually to hear that from an insurance person, but it's just reality is how I look at it. If I'm going to spend, let's say for family coverage is $60 a month or something like that. If I'm going to spend over $700 a year on a dental plan and only use it for cleaning, I might not necessarily do that because it's not going to make the most sense. But if I know, oh, this plan has no waiting period, so if I need something that get done, I can sign up when I need it and then kind of ride out that year for it, then I might do that. But at the end of the day, thinking about that cost versus usage. If you're not going to use it a whole lot, dental is kind of different than health insurance. Health insurance, you don't know. Dental, you don't know either, but the bill isn't as severe as a health insurance bill. So if you're kind of thinking about, what if I need a cavity? What if I have to get a root canal? There are plans you can get that either have no waiting period or a short waiting period. But people often tell me they want dental for cleanings. So I have to get my cleaning every year. Well, think about what the dental cleaning costs you every single year and kind of say, is that worth what I'm paying for? Like, am I going to use that dental 2 or 3 times a year? If so, maybe it's worth it. But if not, you kind of think, well, I'm spending all this money on this policy, not using it frequently. So some policies that's that way. Like life insurance, you won't use it really hardly ever for the most part. But dental is something you use a lot. So you got to think about, is this something I'm going to actually get the money out of it? Because with COVID-19, people have to kind of look at things differently for insurance. With health insurance going up, some of the nice to have things won't be as common. So dental is a good to have, sometimes a nice to have. Now vision, same thing. That's very much a nice to have, not very vital. The reason I would recommend vision for people that are kind of looking for vision insurance, if you have eye issues frequently, or you need an eye surgery potentially, and the plan covers that. Now most vision plans don't cover eye surgery, but some of them have riders to help with that. But if it just for glasses, do the math again. If the policy costs you, let's say $7 a month, that's $140 a year. If the allowance it gives you for glasses is $100, well, you paid $140 to get $100. So that doesn't make a heck of a lot of sense for a policy to do that for somebody. But if you're basically saying the policy is $5 a month, and you pay $16 to get $100, okay, that's a good situation for you. So always think about vision more so like, what do I get for what I pay? Because that's one of those policies people get on autopilot. Studies show most people do the same benefits every single year, like on autopilot. So dental and vision end up falling into that rut. And you think about, if I just keep paying for this policy and I'm not getting it out of there, then I'm not going to be able to use that. And we're having a slow response in the comments, so I'll be saying these kind of way later after you say them. But Diana said, talking about Florida, it is chaos here in Florida. It is open enrollment for off-market ACA from 10/1 to 12/31 right now. For on-market ACA open enrollment starts 11/1 to 12/15. Most Florida residents have to wait until 11/1, but the insurance will not start until 1/1. So yes, this is broken down very well. Thank you for that, Diana. Yes, open enrollment has started in certain states. Some places just have rates you can't actually sign up, but you can see something. So the thing that I don't like about how short it is that November 1st to December 15th. That sounds long, but it's something you don't understand. A month isn't, like a lot of times considering it's Christmas, Thanksgiving, COVID, election. There's a lot of stuff going on. So that's not always the best thing to me, that you get such a short window to pick out a plan that you'll have the whole year. So this is why I'm doing this now, to get people ahead of it so they kind of know a little bit going into open enrollment season. So Florida, it's chaos. So when you know that it's chaos, get a little help. I've told people several times, but it's worth repeating. I don't draw revenue from health insurance. I use health insurance as an advisory piece. So I'll advise you on health insurance, but not draw compensation from it. Reason is, I think it's, and this is no shade to anybody else, but I don't want to get paid for health insurance just because it's something that you might need for medicine or for a surgery. And the story, I probably said a couple of times, but the story where that came from for me was that back in 2013, a woman called me my first year working Obamacare, and I said, I'm going to write Obamacare for my agency. So a woman called me on the eve of the deadline of Obamacare. Woman said, hey, I need to get a policy right now. I have stage 4 cancer. I need to get a policy so I can get a surgery. And if I don't get a policy, they're not going to see me. They already said they won't see me without insurance. Oh yeah, and cherry on top, my husband got laid off 6 months ago, so we're really tight on income right now. So when she told me that, and this was, this is probably 7 years ago now, that has stuck with me, because at that point I said, I don't want to get paid for this just because it's something that she needs to live. Now, if we're talking about like a short-term health plan or a med plan or a dental, things like that, those are just kind of like band-aids. We're going to get by things. We're just something when something bad happens. They're not something you rely on your full year most of the time that makes a big influence in your life. So in that situation, those ones I draw revenue from, but not from a major medical plan, just because I want that person to just know I'm giving the best advice for what they need for their health, because that's not a replaceable thing. That's a big deal. So ever since then, I've just answered questions about health insurance to make sure you understand it. So if you have questions about health, major medical, disability, things like that, that's what the point of today is. And you can always message me to ask questions about that. So that was the reason why now I just look at the policy and say, hey, it's good, it's bad. I'm really very indifferent to any insurance company for health. I don't have an allegiance to one. So I just think about what's the best fit for this person. So with that said, that woman helped her get a policy. Believe she's fine. We didn't talk a whole lot after, but she had a surgery at least. So it's important to kind of know these are the things that affect your entire year. So when you say it's a chaos mess over there, Diana, in Florida, it's going to be like that in other places too. So this is the chance to prepare and get ahead of it. Now, if you guys ever had someone teach you insurance before, besides your HR person, kudos to you. But a little factoid about that is that an HR person's job isn't insurance. Contrary to popular belief, that's not their job. Their job is to make sure you fill out paperwork. So when you always see kind of like that, the HR person's job is enrollment. Diana, you're in HR. Thank you for knowing the things you know, but most people think that that's your job to enroll them in insurance, and your job is to make sure they do it. HR's job isn't to sign you up for insurance necessarily. They have to make sure the deliverables get done and operations run. But at the end of the day, their job is to help you the other stuff. So you really should have someone that's actually trained in insurance to teach you, because I'm not an HR professional. I know a lot about it, but I'm not an HR professional. So when it comes to HR things, I'll say, what's the HR lady saying? But with insurance, it's the same thing. You should ask the guy or the gal that their job is to do that, to ask them questions, so you make sure you're making a sound decision. Because that's where a lot of times people try to figure it out with their parents, with their sibling, their coworker, and they're not really in any better situation than they are, so they can't give a whole lot of advice to help with that. So I would recommend for all of you is ask someone that actually knows what they're doing to get help with insurance, because it is a tricky thing. We have Rosalind here jumping in here. She said, I'm not going to teach anyone about insurance. But third, wait, hold on real quick. Let me switch my mic back on for her because I can't hear the other end of this. Okay, Rosalind, I know you're not going to talk about insurance, but let's jump into it.
Yeah, I'm thinking now, Daryl, you and I, this is a prime time to invade your country. As a Canadian, I feel it is my moral obligation to save you from yourselves.
It is like engagement time because we're weak right now.
Yeah, and then you can teach them about insurance, and I can teach them about how to express their feelings and disappointment and write some poetry.
Well, they can use it for the therapy. There is mental health covered by a lot of insurance stuff for certain things, so they can use the some of the policy to cover mental health.
Exactly, and you can do some rapping. I think the rapping would really help them out right now, seriously. But I digress. Yeah, sorry. Go ahead. Yeah.
Well, I was going to ask, because you're in a socialized health insurance kind of situation. So when you see the plight the U.S. is going through with healthcare, and people always joke about, I'm going to get Canadian citizenship so I can get healthcare. Yeah. Explain to people the the difference in certain care, because there's these myths out there about you wait a year to see a doctor, you can't go see anybody for months or whatever. Kind of break down the difference in how you guys operate versus how we operate right now.
Are you saying? Yeah, I find it kind of funny. Oh, we're waiting. It's like Soviet Union here, and we have to wait in line for weeks, and they give us Band-Aids and Q-tips in the line. You know what? We can see a doctor seriously like almost 24 hours a day. I hate to brag, but it's true. My mom is at the doctor all the time. So are all her friends, and not wasting time, but it's that easy. And
Yeah.
a blood test 5 minutes away. You need a blood test, you line up, you get your blood test. So there's a lot of willful misinformation and lying about our access to healthcare here, surgery. You know what? I had a massive ovarian cyst removed 2 years ago. They were wonderful. It was only late because I was too scared to have it taken out. Okay. I'm just an overall bad patient. And I take healthcare here for granted, like a lot of Canadians. I take voting for granted, for God's sake. Like I heard today about more voter suppression in Texas. So now, because of all of you being denied your basic civil liberties for healthcare, I have to really appreciate what I've got here, because I can see my doctor pretty much anytime I want. Show my health card, I get in, and it's I can't explain to you the relief. It's one thing, like life is hard as it is, but it's one less thing to worry about. Now, the only thing we don't have here that's covered by our healthcare is dentistry. Why they skip them out, I don't know. But yeah, I definitely wish we pay a lot here for a dentist, but other than that, I mean, and we pay so little for medicine too. We know that many Americans cross the border, to buy medicine here. Well, I don't blame you. I saw your wonderful Katie Porter grilling that guy about a pill for cancer going up like from $260 to like 500 and something, and people can't even pay for one pill that fights a disease called cancer. I mean, that's criminal. That's just criminal.
Yeah, what's even more criminal is that doctors get commission for certain medicines. Actually, they actually get commission for selling certain medications. So that's a whole other hour show. But I just wanted to make sure people understood that.
Free, Daryl. When I complain, that's how bad I am. I complain about, let's say, I had to get eardrops this year, and the eardrops were expensive. My doctor goes, you know what? I have a whole cupboard full of free eardrops. Do you want them? I go, heck yes, I want them. Now, it took them longer to work, but they worked. Okay.
Right.
I saved a ton of money, and all doctors here, they give you all the samples that they can give you. Seriously. Yeah.
Well, thank you for sharing that, and let me know it's across the pond. I'll let you get back into the chat. Thanks for jumping in, Rosalind. We're gonna
support Daryl, people. Get on here, get mad. Come on, support Daryl. He's the best guy here on this platform. Come on. Yet again, relying on Canadians like me, I can't do everything for you guys. Come on, go support Daniel.
Thanks, Rosalind. You be safe out
You're
there.
welcome.
All right, so real quick, guys, let's give a shout out to Bowtie Nation. Those of you who know a Bowtie person, make sure you tag them in the comments. We're going to have our roll come up right now. It's Bow Ties for life. That was Queen Marissa Lee. I threw you guys a curveball with a female rocking the bow tie. You don't see that often, so that's what, as soon as I saw it, I was like, oh, Marissa, I got to represent for you for the bow tie people. So thank you, Queen Marissa Lee, for wearing the bow tie proudly. And to catch up with comments, we had a comment from Miss Diana. Let's switch back up here. Diana actually said, HR generally is there to give your company offer options, and it's up to the employee to decide which option is best for them. So for those of you that think HR job is assigning you up, this is from a seasoned HR professional with many years of service and education. HR is generally there to give your company offer options, and the employee decides what they want to do. So in that explanation of that, they don't have to get deep in detail about the plan, because that's not their job. Their job is to say, hey, here it is. Do you want it? And they're not basically tasked with, making sure like what you're doing. They're just saying, did you sign up? Did you sign up? Did you sign up? That's their job, is to kind of make sure that gets done. So that's why it's important to understand that HR, they do a great job, but that's just not their job. And they're not trained in insurance. I talk to HR professionals all the time. They're like, I don't know what this means. You're the expert. Tell me what to do. So that's not to say they're bad. It's just there's a million things HR has to keep up with, and insurance verbiage is not one of them. There are some that know more than others. Like shout out Dieter Giles. She's a great HR professional. She knows a ton about insurance and everything. But there's very few that go that in depth. And then Rosalind said Janelle Monáe bow tie. Thanks for the Janelle Monáe bow tie. So something else that I get questions about real quick, this came from the story as well, is the difference in life insurance. So commonly when I talk to people, they ask for life insurance, and you guys have probably seen commercials where they say, get term insurance for not even term, they say get insurance for $10 a month. Now there are two main types of insurance. There's term and permanent. I didn't want to say a whole universal, but there's two categories, term or permanent. Term is for a time period, 10, 20, 15, 30, 35 years, depending on the carrier. They're different fragments of time. Permanent is basically to a defined year. So it could be till you're 100, it could be forever, it could be till you're 125. There are different kinds of permanent policies. The key difference for people, and I hope everybody understands this, is look at your policy. Oftentimes when I talk to people, the worst conversation is when I have somebody call me when they're 62 or something, and they say, oh, my policy renewed and it's like $500 a month now. Now, the reason that happens is because a lot of people get a term policy when they're 20 or 30, they're 20, 30s or 40s, they get a term policy, and they ride it out for the 30 years, let's say. And then at the end of those 30 years, what will happen is the insurance company will say, okay, you've been alive this long, we'll reinsure you, but now it's at a permanent policy. Now, permanent policies are more costly. The reason they're more costly is because they last to your 100 or some other age. So they have a higher cost of insurance because the likelihood of mortality is very high, because the only thing that's not a gamble for insurance really is life insurance. That's always going to have a claim paid out because people pass away all the time. So the mortality for a permanent policy makes the cost higher. So what will happen is the insurance company will say, okay, you're 80 years old now. We'll let you keep the policy, whatever face amount you had, but at 80 years of age. So that makes the prices ridiculous. So I would highly, highly, highly recommend that you know what kind of policy you have, because if people are in a situation where they're like, they're relying on the life insurance for something happens for the family, they're relying on it for retirement or whatever, or just to say, hey, I don't have enough to be able to have a large, 2 years emergency fund and stuff like that, something were to happen or I passed away, then that's where life insurance kicks in. So they're going to make sure they have that safety net. So you should know what kind of policy you have. Nothing wrong with term. Term is great for young kids, but you're going to still think about the permanent policies as you get older. I usually see people in their 30s and 40s think about that more, just to say, okay, the rate's going to go up a lot the longer I wait. So a permanent policy is very important to have, whether your employer provides you life insurance or not, because you're not going to work that same place forever. You might change jobs. I mean, it's pretty common that people don't stay at the same place forever. So with that being said, you want to have that permanent policy to go with you when you retire, when you switch jobs and the next place you work doesn't offer life insurance. So please, 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 for all of you to make sure that you have a permanent policy in addition to if you got term, or just replacing the term policy with that if you can afford to. Because I get calls for that semi-often where they're like, yeah, my mom turned this age and now she needs a policy, or yeah, my dad had one in his job and he retired and now he doesn't have a policy. Which brings me to an interesting point somebody asked me on the phone today. The policies you have from the company paying for life insurance, this is pretty common in the U.S., maybe not so much abroad, but in the U.S., a lot of companies pay for a company life insurance plan. That's why you work there. Now, in my experience, I don't usually have claims for those policies that often. It does happen, but not often. But that's when you work there. When you leave, you have nothing. They don't usually let you keep those policies. I mean, when you look at the cost, sometimes they're 5 cents a check. They're very cheap. So the idea is that the insurance company's like, we're not going to do processing and follow up and all that for 5 cents a week. This is a deal that your employer pays with the health insurance or the dental. So it's a low rate in that situation. But when it comes to leaving, they're like, you leave, that's it. So that's an option that is good. It's good and cheap where you have young kids, good option. But still, please consider for yourself to make sure you have a policy outside of work, because those do not go with you. And I've seen people like end up in a scarier situation when they're older because they might still have a mortgage. They might have kids that still rely on them. And that's more common nowadays, that the kids live with the parents live with the kids when they get older or something. And they got to have a way to deal with, like, what if something happens? How can I deal with this? So for your own sake, just make sure you understand what you have. I'm not about switching life policies just for the sake of switching it. I am for about you knowing what you have, though. So at least read it and know what you're talking about. And then comment from Queen Shara Ruffin. Thanks for loving my tie. Interesting fact for people, my necktie, my bow ties are neckties. People think they're bow ties, so don't tell anybody. But my bow ties are neckties. Shout out to my wife for telling me about that. She showed me a video 7 years ago, I think now, that talked about making neckties into bow ties. So I think I have one picture on my Aflac profile where I actually have a necktie on. But everything else you see is me in the bow tie. So life insurance, just make sure you know what you have. Read your policy. There are certain organizations, I won't say names, but there's certain organizations that have a bad rep for selling people accidental life insurance. So has anybody here ever seen an accidental life insurance policy? Let's switch this real quick. Let me know if you've ever seen an accidental life insurance policy. Hit a reaction for me, please, so we can see that if you've ever seen an accidental life insurance policy. Now, the organization I'm referring to, sometimes people will buy a policy thinking it's a term policy or a regular life insurance policy, quote unquote, but it's actually accidental. What that means is the policy only pays the death benefit if the person passes away of an accident. Now, some people will argue a heart attack's an accident. No, they're talking about gunshot, car accident, shark, and any kind of random thing. To say if you die of an accident, then the death benefit will pay. Now, since it's in that narrow focus like that, the rate is cheap. So it's a very low cost policy. So it's great if you're a hunter or you competitively race, or maybe you're an MMA fighter, like something that you're not paid to do, but it's a hobby of yours. Then those policies are awesome because they're cheap. And they're like, well, my friend died in a motocross accident, so I do motocross, I might want to get that kind of coverage. Then they're cheap just for that situation. But for the person that's thinking they're getting a regular policy, it's a horrible deal because they're thinking I have a full regular any kind of passing away life policy, so my family's okay. No, it's not that policy. It's just for an unfortunate accident. So I'll caution people to make sure you know what you have. That way you're not kind of, oh, I'm good, I got something in place, and then you don't actually have that. So if anybody's following me for a while, kind of seeing the content, that's very important to me, just knowing what you have for insurance, because I'm not a financial advisor, but I'm an insurance advisor. So when it comes to insurance products, the next you know what you have is very important to me, because people call me all the time. I don't know what I have. I signed up for this 5 years ago. Don't know what it is. What is this? People get upset about insurance mainly because they don't understand it. That's the biggest reason people don't like insurance, because they don't know what the heck they have. Kind of like legal work. People don't like lawyers and legal work because they don't understand what they're signing or what they're agreeing to. So insurance falls in that same bucket because there's a lot of legalese and a lot of jargon in there. So with that being said, it makes it confusing for people, like, what is this? So if you don't understand those things, that's why I should be sticking around watching this, because these are the things that you should talk to someone that spends their time doing that to understand it. Because if like Rosalind came on here, she's a mental health expert in motivation. I wouldn't try to teach that because I'm not an expert at that. But if I needed that, I'll talk to her about that. So that's what you think about. Speak to someone that's an expert at what it is you need help with, just to find out. Because I don't know everything, so I try to find help if I can. I'm hard-headed and don't always do that. But this is that time of year that it's a hyper focus. There's not many things you do in your world that are like everybody's doing at the same time. So this is in the U.S. This is that time of year. Everybody looks at their insurance and says, okay, it's time to do that. So with that being said, you'll see commercials, billboards, emails, banners on web pages. This is that time of year that everybody's going to be talking about health benefits, dental, vision, disability. So with that being said, since it's a hyper focus, get some help. I know it's important in February and April and all those different months, but it's not everybody's thinking about it. So if there was a retirement month, all of us would probably talk about retirement the same month. If there was a 401k season, we probably do it all the same time. The only thing that really has a season for us financially is open enrollment season. So Medicare is underway. Affordable healthcare is underway. Business benefits are underway. So all these things are happening. So get help. Just ask people for what you need. What I'd also like to recommend people do is actually pull out their policies if they have access to them. I understand in this digital age, sometimes you don't have a paper copy of your policy. Ask for one. An insurance company has to provide you a copy of your policy if you call and ask for it. So if you know you have Blue Cross and you lost the paperwork, all you have is the card, ask for a copy of it. And sometimes you can just Google it. Sometimes you can Google the policy if you just look up the codes on your card. You can look it up and see, what does it cover if you don't remember. But if you want an actual paper copy, they mail you one usually when you first sign up, but maybe you threw it away because it looks like junk mail. Ask for another copy because it's something that when you're going through a major issue, it can help to know the fine print, quote unquote, for the different things that happen. So I'd highly recommend at least knowing, we talked about HMO, PPO, POS, and last couple terms to kind of make sure people know. Deductible, that is the number you have to satisfy before you get co-insurance, which is the second one we're talking about, before you get co-insurance for the insurance company. So deductible, 5,000, 6,000, something like that. Co-insurance is the portion that the insurance company pays for your behalf. So if you see a plan that says 60% co-insurance, that means you're paying 60% of the coverage. And read that to make sure, because sometimes plans write it backwards. They might write 40%, meaning that's your part you're responsible for. But often they'll write what the insurance company is responsible for. Just look at it. If the number is larger than 40%, then it's the insurance company. If it's less than 40% or 40% or less, then it's your part. Because the most the plan usually has is 40% on your end paying for it. So just kind of look at that on your plan summary to see if the number is greater than 40%, it's the insurance company covering it. For health, it is at least. If it's 40% or less, then it's your responsibility. And it'll say that if you kind of pay attention to it, but it's kind of tricky sometimes. So co-insurance is the part that either you're responsible for if it's written that way with the insurance company. And lastly, out-of-pocket max. For anybody that's had like a negative feel for affordable healthcare, the most positive thing has been out-of-pocket max. Now, out-of-pocket max means that if a bill goes to the insurance company for $1 million, the most the bill can be is based on the out-of-pocket max. So it might be $13,500, which is still a big number, but it's way better than $1 million. So if it goes to the insurance company, it has a ceiling to how much it will be. So know that number as well, because this is where planning certain things makes it easier for when you know a big situation coming. So let's say somebody has a major surgery coming or a childbirth or something like that coming up. They might say, okay, the surgery is going to be, let's say, February next year. That means when you look at their plans now, you should look for a deductible that's somewhat high for the year you're not doing anything. But for the year of the surgery, you might want a low deductible because the surgery might cost $50,000 or something. And your out-of-pocket max on your plan this year, let's say it's $15,000. You don't want to pay the $15,000 now. So what you'll do this year is get a lower cost plan by getting a high deductible. So you pay less this year, and then the year of the surgery, you get a low deductible, which costs you more per month or per pay period. But when the doctor bill comes, it's much more agreeable. It's much lower policy. So you kind of got to jump around plans if you know something's coming. Now, if you don't know, then that's harder to kind of deal with and planning out those situations. But my general rule of thumb for people, when you get a health insurance plan, if your premium costs as much as your deductible in 6 months or less, that's usually not the best situation for a health plan, in my opinion. This is totally my thoughts. Somebody else can say different, but if you basically say, I'm going to pay $1,000 a month for a health plan and my deductible is $5,000, when 6 months pass, you paid your deductible in premium. So that's where, to me, that's kind of like a upside down policy. So think about that when you're looking at health plans. Like, if I'm going to pay as much as my deductible in 6 months or less, I might need to change a few things and make it more for you. Well, as we wrap things up, I appreciate you guys hanging out with me in my rants. I know insurance is not fun. I'm not trying to make it easy and not super complicated. Please, if you have questions about insurance or someone that needs help with that, tag them in the replay and let them know to watch this and check it out. And also send them to my page. I think it's backwards when I do it. No, it's this way. So send them to my page so they can take a look and find out more information. I do consultations for free to make sure people know what they're looking into. And again, for health insurance, I don't draw compensation for that. I'll find someone else to do it, basically, that's doing that, but I'll advise agnostically just to make sure it's the plan that fits your needs. We will catch you next time on Business and Benefits. And please, voting, vote. Some places already have early voting happening. Virginia is one. My dad's in Virginia. Early voting already happening there. I forgot other states doing it, but if you're in Georgia, it starts October 12th. So we have early voting starting here in 10 days. So it's important to pay attention to that. And Diana had a good comment. Thank you, Diana, the queen, for putting that up there. Great information session. Thank you for walking everyone through the insurance process of a great weekend. Thank you for that, queen. Voting is happening now, though, for some places, and it starts October 12th here in Georgia. I think Florida's voting now, too. So, Diana, if voting's happening in your state, go out there and get it done. But please be safe, wash your hands, wear a mask. We've obviously seen that COVID-19 has penetrated the White House now, so it is a real thing. Please, 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 go vote. Let's have some change happen because a lot has been going on these last few years. Let's go exercise our democracy by voting. We will catch you next time on Business of Benefits.